So, I mean, we know we've been saying this many, many times throughout the whole event, but this has been really a tremendous honor to put together this initiative, to be able to have great co-organizers like Alfonso, Stephanie, Paul, and really our whole entire volunteer team, which, at this point numbers that's somewhere around 35 to 45 people who are coming in from not just from MIT, but from our partners at Health and at Cornell and others who are volunteering their time to support this initiative as well. Also, again, want to really thank our clinical partners, Mass General Brigham, Oregon Health Sciences University, the VA, National VA System, Universal Health Services, Weill Cornell Medicine, and Johns Hopkins University, who really helped us bring to us the clinical problems, the problems that they're facing day in and day out right now by the clinicians, by the patients, by the hospital systems that are most pressing. And looking forward to continuing working with them to continue to address some of these challenges in our future virtual hackathons and events over the coming months, and hopefully can make a small dent in the current crisis. And of course, want to thank really and it will take me too long to name all of our other partners that are involved here, but I'm very, very thankful for every single one of you that have taken the time to have these calls with us over the past 2 to 3 weeks, really pull online very quickly and mobilize and activate very quickly, not just your various institutions and companies, but the mentors and the experts, the judges that you're bringing to the table here for this weekend, but also those same mentors and experts and resources that you'll help provide to our participants and the teams that can choose to continue. And along those lines, I do want to highly encourage that, just because you didn't win one of the prizes for this hackathon, it really doesn't mean anything. In our experience, there's no correlation between who wins one of these prizes versus who's going to be the most successful after this weekend. So, to echo, I think what's been said before, continue to work on these ideas. There's no shortage of problems out there for us to solve around COVID-19. And even if you don't continue with your current idea, stick together with your team or form new teams with other people you've met this weekend and tackle another problem and provide some new solutions in that space. With that, I really want to thank, of course, all of the judges who spent their whole afternoon with us today. This was some selfies from our get together right before all of these sessions kicked off. I think we have somewhere around 40 judges that came together to listen to the, was it Paul, 230-ish teams or so and presentations. They represent most of our partners. A lot of our partners are represented here, but also, again, leaders from the healthcare innovation ecosystem from across the globe, and really crossing every time zone across the globe as well. Secondly, I want to recognize, and I apologize, this is not our entire team, only a small subset of our entire team, but really want to thank everyone on the organizing team that have put in countless and countless hours and have put up with probably, like Alfonso said, all my messages and texts and emails at godly hours throughout the day and throughout the evening. And we couldn't have done this without all of the volunteer help that is part of this organizing team. And the participants, I encourage you to send your thanks to all of the members that you've interacted with over the weekend. They've done a tremendous job pulling off what essentially is our first virtual hackathon on this scale, having 1,500 participants, easily over 200 mentors, and probably another 100 people from our various partner organizations are involved. And I think for more or less, things have gone more or less fairly smoothly throughout the entire weekend. And that's speaking from experience, having run a lot of hackathons through Hacking Medicine over the years. And I think some of my fellow counterparts in MIT Hacking Medicine can also say the same as well. We were prepared for the worst, but we thankfully did not have to get there. And really were afraid of all the potential technical failures that might come to bear. Though I would say personally, I am very surprised that Google was the one that was going to fail the most for us. Slack and Zoom really held up fairly well for us. So again, thank you so much to the organizing team for everything that you've done so far towards this weekend's efforts. So the first track, Alfonso, are we doing it by track leads?
Yes, let's do it by track leads. And the first track lead, I believe, was Paul.
That's me, yeah. So I'd love to talk a little bit about track A and the amazing work that I saw this weekend. All the improvement and iteration was awesome. So track A, for those of you who are in other tracks, is all around expanding and improving access to COVID-19 education and resources. We had 4 teams that really rose to the top here, even though everybody did such an incredible job of forming teams, pitching problems, and iterating over the course of the weekend, culminating in such amazing presentations. We had Bridge Aid, which is empowering local NGOs with donations from the community. They were one of the top 4 winners. Spread the Facts. They were empowering low-income African-American communities in protecting themselves against COVID-19. The third team we had in our winning pool was Disjoin. They were protecting the community by setting up real-time traffic alerts for booking and visiting local stores. And lastly, in our top 4, we had team FMPE. They were sharing instructions on how to make DIY masks to basically use resources through communities around the world, leveraging existing distribution networks on other products. Seeing everything from all 4 and how they were able to come up with these great solutions on how to improve access to education and resources was very inspiring. I will now move it on to track B.
Hey everyone, Michael here with track B. Track B had a who to test and when to test framework for the problems there. And we saw, just as Paul mentioned, tremendous progress over the course of the weekend, enthusiasm at the problem pitch session, and only continued to build from there. I'm excited to announce the 4 winners, although not exclusively the good pitches in track B, are Project Zero, iPool, QuickTree, and In Control. And really what these teams worked on is ways to identify people who could possibly be contaminated, people who could have been exposed, and how to optimize testing. And with that, I'll pass it on to track C.
Hey, track C. I'm so honored to just connect with you one final time, this all together. I think, like I said before, you did an amazing job. I've been so impressed. Going from Friday night, sometimes not even slides or slides the wrong way around, and then Sunday you were just killing it. Just had a really hard time picking the top 4, and they said, and like we said all before, it's go on, everyone, each ID, please follow through, because they were all great. So then our 4 winners, they're already up here. So the first one is Smart Triage. So with their system, they could give patients a different score, risk score, and based on the risk score, patients knew how long they should have to wait before they could get into the hospital. Our second is, sorry, this is in random order, by the way, is CoValert, which is an SMS-based rural health triage and monitoring system, which is sort of low technique with SMS, such that it's available for many different types of groups. Then we have CoveMD, which is a telemedicine platform that connects doctors from countries that have already passed the surge of infection, so that have more availability of doctors to connect them with the countries that actually have a really high surge and really need doctors. And finally, MIT Magic, who had Call the Captain, which is a voice-driven phone and text-based assistant. Thank you all. And then track D.
Igor, we have you muted.
Hi, everybody. Igor here, track lead D, treatment management. Very honored to present our top 4. We had some really innovative ideas presented, excellent problem problems identified and innovative solutions presented. And it was a really tough battle. We just joined the presentation now because we were trying to figure out with the judges which four to pick. So happy to announce that we selected Go with the Flow. Their solution is the fact that there's a shortage of ventilators in the country. They're working on designing a 3D printed splitter for ventilators that could be allowed use of one ventilator for two patients. They have a very good executable plan that I think will help both the US and the other countries deal with a ventilator need. Citizen Science is using a data-driven data science approach to identify data patterns across different data sources and to be able to predict which patients are at highest risk for COVID and to track outcomes. Dr. COVID is working on creating a data repository which is able to pull different evidence from research studies across emerging treatments that are being developed for COVID. There's a huge need for that. And then finally, Route is working on a solution so the issue is that hospitals are now a hotbed of infection. If you're not infected, going to a hospital is a high risk proposition for both patients and staff. And so they're working on a tracking solution that will help optimize routing in the hospital so that patients and staff can stay away from areas that have a lot of infected patients. So we felt that these four groups came up with solutions that address various needs in the current COVID crisis. So thank you very much.
Thank you, Igor. And this is Track E. I feel fortunate and blessed that I got to work with this group as part of the hackathon with Track E in a subject that I'm personally very motivated by, and I think there's a lot of opportunities here to innovate. Track E was focused on the impact of social distancing and quarantine. And we had 4 winners: Distance Domestic Violence, Livestream Now, Moose, and PopTracker. Distance Domestic Violence is effectively a web-based platform, as you can read here, that allows individuals that are at risk of domestic violence to assess whether or not they're at risk through a simplified risk assessment and to get the resources that they need. As you can imagine, that is a population that is high at risk in these times where everyone has to be at home. Livestream Now is actually it's, as the name says, a live stream platform that it's meant to go across platforms and unify people in these times where connecting in a live format and live cadence is really hard. And we believe this is a huge thing for everyone that is essentially in social isolation. Moose was an awesome idea as well, an online exchange platform that instead of using a currency for like a monetary currency for you to exchange exchange skill sets, they have time-based tokens, which was a very neat concept, I thought. And then PopTracker. PopTracker was a really cool team to see, starting from something that I didn't really understand the first time I heard the idea to a final presentation that was so clear and synthesized that I was really proud to see it. They essentially develop these low-cost devices that allow for public officials, or generally, in this use case that they're targeting, it's public transit organizations, to quantify local populations at a very specific level. So knowing how many people are there in a given wagon in the subway in New York City, so that individuals that have to take the subway to go to work can optimize or minimize the risks of infection and maintain social isolation by knowing the specific population's densities within these vehicles. With that, I'm going to pass it to Track. Do we have for Track F?
I'm here.
Hannah, great.
Yeah, so Track F, it's a our track was, yes, identifying the COVID-19 immune. And I think this is a pretty narrow track, which resulted in a lot of similar ideas, but I think everyone did a great job of trying to figure out what makes them unique and presenting it that way. And I just wanted to say too that I hope you guys will keep continuing on, because you all were very passionate about it. And I really enjoyed working with you all and seeing how you guys came together to solve problems and helped deal with all of the craziness very smoothly, and yeah, showed a lot of patience. So our first winner was the COVID Busters. Our problem is find out how to identify people that are immune and have achieved herd immunity to COVID-19. So this is a great idea that they can, I do believe it's called Snowflake is their idea. And Snowflake is this application and algorithm that they'll use to be able to identify the COVID immune. So COVIS, this was our next winner, congratulations. And that they built to determine the immunity status of individuals using intelligent algorithms without requiring lab testing to avoid stressing the health system. Another really interesting idea. They had a really great presentation, and we were all impressed by how well they were doing, and we were impressed with how well they were able to get their idea across as a way that it could be implemented really soon. Cody, this was your hidden immunity app. I'm sorry, I don't have more. Cody, if you'd like to post in the chat more about what you and your app did. I remember that you guys had a nice little app demo in your presentation that was really cool, and we enjoyed looking at that. And our last winner is Immunity First, and how should communities prioritize who receives COVID-19 immunity tests? So we had lots of different ideas that, well, they seem similar, but they all had very unique ways of approaching things. And it was really fun.
And track G is Stephanie.
Track G. We were really hyping Track G. I'm so excited to announce these winners. You guys, we had such talent in Track G. We're looking for new ways to deliver care in this new world that we're dealing with. And these folks had such interesting ideas, and the progress that you guys made from Friday to now is just wild. So we had to pick 4, and the judges, I think, did a really cool job of sprinkling around the kind of like focus areas of these 4 teams. So super, super proud. Wait lists is the first one. Waiting rooms suck. I don't know the number of times that I had to hear that this weekend from the waitlist team, but you guys, you did it. So they want to create a digital waiting room so that people aren't sitting and getting infected in the waiting room now and also in the future, because they were never fun. Team Immunocompromised is an interesting layer that kind of thinks that high-risk individuals need help from their neighbors. And so they're kind of putting, at least right now, a layer on top of Nextdoor. And in the future, it's going to be this really cool system that helps you to learn more about what's going on from the people around you. Agora Health, I think it's so cool. It's looking at this surplus of physicians and folks from the medical community that are sheltered at home and helping to onboard them quickly and seamlessly onto telehealth platforms to create a telehealth marketplace with this interesting supply that we have right now. Mental Health Coverage Now is saying that if you are losing your job right now, you might lose your health insurance, and now is just not the time to lose your mental health benefits. Like this is not the time. And so they're trying to create kind of a partnership model with payers and with state providers to figure out how to continue that continuity of mental health benefits. I'm so proud of you guys. Good job. Congratulations to anybody who didn't win. Keep going, 100%. You guys can keep building, and you guys can make your thing successful, and to all teams. So good job, guys.
And I had the pleasure of having Track H, which covered especially the hospital assets, coordination, distribution, especially in this stage where our shipping logistics pipelines have been kind of been frozen more or less, and was really, really great to work with every single one of the teams and as was echoed earlier, to see that progression on Friday night where we were sitting in the problem pitch room, and I know I was forcing you guys to pitch problems, but really coalescing, building those teams over the weekend. And at the end of the day, at the end of every one of these types of hackathons that we do, constantly amazed at the amount of iteration that you guys go through over just a short period of time in 48 hours. And just imagine if, the whole world was able to produce that kind of work in just these intensive sprints that happen. So, the 4 winners, as was mentioned, the other tracks, there's no particular order here. They're all, equally great teams. And of course, echoing the prior words that, if you didn't get recognized today and didn't win, do continue on those with your ideas. So the first team that we have listed is Never Latte Again, which is looking at building an integrated supplies management system through a machine learning powered object recognition system to give real-time feedback back to the health practitioners to focus on, so that they can stay focused on helping get better instead of this more administrative type of work. The second team is Remote Possibilities, who they're trying to build a platform that synthesizes the newest and most reliable medical data and essentially the best practices, clinician-provided innovations as well to help hospitals navigate this crisis. And this team was really focused at trying to bring the best ideas out of the noise in terms of the best practices that various hospitals use that we can quickly not only review, but then spread to other hospitals to implement very quickly. Corona Connect was focused on an application for automating and managing the inventory and the supplies that a hospital system has. And then the fourth team is MedLink, who focus on developing a model down to the county level that pulls from multiple live data sources to allow hospitals to predict what their PPE burn rate is, trying to identify which hospitals are in higher critical need so that they can best help suppliers prioritize the hospital needs and give them the direct supply of PPE. So then to track I.
Hey all, this is Maura. I had the privilege of working with Track I throughout the weekend, which was focused on space conversion, utility, and projections. And it was really just such a pleasure to work with each of the teams, see how far they came throughout the weekend, and at the same time, see such creative and diverse responses that each team came up with. And so our judges did have to narrow it down to 4 top contenders. And in no particular order, they're Isabella, Nafasi, Quarantine, and ClearCare. So Isabella is using machine intelligence to give better space allocation recommendations to allow care providers to host more COVID-19 patients. Nafasi came up with a wearable anklet that tracks, monitors, and stores information regarding people's whereabouts within makeshift hospital spaces to make sure that if somebody's contaminated, they know who they've interacted with in the time previous. Quarantine created a temporary post-acute care ward made up of RVs that's arranged in empty parking lots next to hospitals. And the hospitals can then supply the skilled personnel needed for the care recovery, such as physical therapy or other types of care. And then of course, ClearCare is a mapping tool to let people with medical needs find non-COVID specific care quickly. And so these were just 4 of some really, really incredible presentations. And so thank you all for letting me be a part of your weekend. It was just such a joy to work with each of you. All right, on to next, Jay.
Hey guys, I had the pleasure of working with you guys on Track J, and I'm really proud of how things all came together. I think following you guys through the pulse check-ins, the practice pitches, and then through to the final presentations, it was just amazing seeing the kind of progress that happened on Track J. Big shout out to Dania Day, who was also on here in the panelist list and who co-managed Track J with me. Also shout out to the mentors and to the judges that helped you guys provide feedback and things like that. So the 4 winners for Track J are Sriher. Sriher worked on an idea for creating reusable PPE and in a sustainable manner, using sort of chemical engineering to devise a way that we can kind of we can build a suit to allow doctors to wear PPE without having it be disposable. Lifting the Pyramid addressed the issue of a lack of healthcare professionals that covered all the required tasks in the hospital during the crisis, really kind of reallocating healthcare professionals or reallocating the workforce to assist healthcare professionals. Team 37 built an app that was addressing mental health services for frontline healthcare workers and addressing the huge strain that is being taken on frontline healthcare workers during this crisis. And rural optimization focused specifically on Peru, where disseminating information and best practices to rural doctors is really vital. So the judges were all really impressed with the four teams here, and just in general, we were really impressed by the many presentations that we saw in Track J. So congratulations, guys.
And I want to take this very quick opportunity to really recognize the track leads who have done a phenomenal job working with all the teams, really keeping us all on track. And again, give you guys a great hand of applause, because it's no easy feat. I know some of you, this is your first virtual hackathon, so hats off to you on everything you did and everything going so smoothly. I'll turn it over to Alfonso now.
Great. So we want to wrap it up with saying, first of all, stay in the Slack channel that's going to be open for another 3 months. Use it as a platform for collaboration, for continuing these ideas onward. The video, by the way, it's going to stay enabled, so you guys can use that, so go at it. What I mentioned earlier, and some folks maybe didn't hear this, the fact that we coalesced so many partnerships and that we had so much support from all sorts of organizations, both from the healthcare space as well as from the technology space, it's something that you should take advantage of. So take advantage of that. Connect with our partners. Move forward with the support that they can provide you. And please fill out the survey. The survey is what allows us to know what are the key things that we need to change in the future, which I think there are many, because this was not a perfect event. But this allows us to know what are the specific ones that we need to prioritize in changing, and what are the ones that we need to keep. So close it out here. Follow us on social media, MIT versus COVID-19, or hashtag MIT COVID-19 challenge. Boom. There's also the LinkedIn group that got started by Henry. It's posted on the general Slack channel. And with that, I want to say thank you so much.
Alfonso,
yes,
a couple of questions that we've had come in from the Q&A that it would probably be good to address. A lot of people are asking about where to find specific videos, resources, presentations after the fact. If you just follow along at covid19challenge.mit.edu, anything that will become available publicly will be posted there for you. For those who are on winning teams, we will reach out to the primary contact from each team to gather additional information, to pay out money, Amazon credits, those sorts of things. And I think there was one other question about judges' feedback. What's the process for that, Alfonso?
We can also relay back the judges' feedback that they jotted down while you presented, and we'll do that through the primary contact for the specific teams. The one thing I wanted to mention is also accessing that, I forgot to mention it on the previous slide, the participant guide. The participant guide that we put together, which is a deck with a lot of information, includes a lot of resources that you should exploit. We will also update the participant guide to include the recordings that were relevant throughout the weekend, both per track as well as the general open events like this one, as well as all the technical resources that you can use to take these ideas moving forward. So we'll update that, but also we'll update anything that would be publicly available to not only participants, we'll also update it on the overall MIT COVID-19, the COVID-19 challenge.mit.edu website. Anything else I missed, or any questions that you've noted that you think we should?
A lot of people asked about certificates of participation. Unfortunately, given the number of participants, we unfortunately cannot produce those. There was a question about an article or press release going out that will be in the works, so be on the lookout for that via social media. And I think the only other thing to note is please, thank everybody involved who helped you along the way. That goes a long way.
And this is the team, the wonderful team that made this happen. I love this picture. All right, Freddie, do we have anything else that we needed to touch upon?
Nope, I think we got it all covered. Everyone, now that you've spent the last 48 hours with us, go get some sleep before the new week starts, and wait to hear from us to really re-engage you in this post-hackathon period. Again, continue to develop your ideas. If your current idea isn't the right one, go pick another idea to work on to help us in this fight against COVID-19. Again, can't thank enough all the organizing team that's been involved. You guys have been phenomenal throughout not just this weekend, but the last 3 weeks that we've been planning this in a very short amount of time. A big thank you to our mentors who have been, I think, very enthusiastic for sure in being involved all weekend long at all hours of the day and night. To our judges who helped identify some of the more promising ideas as well. But really can't thank enough the entire community and ecosystem that came together throughout this event at every single level, whether it's the organizing team, the mentors, the judges, the participants coming from over 90 different countries and 49 different states, and the partners of the ecosystem. This is truly, truly a phenomenal event that's been put together and initiative that's been put together. So, and I really want to also thank Alfonso for being my partner in crime from the very beginning in this. He reached out to me initially with this crazy haired idea, and we just skyrocketed from there. So Alfonso, hats off to you.
You made this happen, and everyone in this picture as well. With that, people have a good night or good day, depending on your time zone. Bye-bye.